Now I have the pleasure of introducing one of my colleagues from Arizona, Dr. Teresa Seville. And Dr. Seville did her medical school in the Philippines at the University of Manila. And then she went to my hometown, Chicago, and did her residency at Loyola. Also did her fellowship in ID at Loyola, and now, as I said, she's in Arizona. And her areas of interest and expertise are in infection prevention and control, antimicrobial stewardship, and nosocomial infections. And I had to push her to come up with a fun fact, but I think this is a good one. She was initially interested in orthopedics until she got to having to do a hip dislocation. And I think she realized that she was too strong, but perhaps it was that functioning with her brain is better than with her brawn. So thanks, Teresa.
Okay, it's a tough act to follow, Dr. Wilson. So here goes. So Dr. Verk tasked me to go over some general ID papers for last year. And then a few days ago, she said, can you add an article that was published like 10 days ago or a week ago? So the slides I'm going to show you, there are a few additional ones that are not on the syllabus, but my email address is there. So if you want this set, just email me, or if you have questions, just email me and I'd be happy to send them to you. And by design, the articles that are included here are those that are likely not included in the other talks that you've already heard, because I assume that they would talk about the top papers and whatever topic they were going to discuss. Okay, so here goes. So the first one, probably not a secret, is the POET trial, which was the partial oral versus IV antibiotic treatment for endocarditis. And this is a randomized, multi-center study that was open label, so it was not blinded, but there was an adjudication committee in charge of determining the outcomes that was blinded to whatever assignment the patient was in. So in the supplementary material, the protocol is like this. So they included any adult with a left-sided endocarditis, native or prosthetic valve, due to Streptococcus species, Staph aureus, or coagulase-negative Staphylococcus, and Enterococcus fecalis. And they had been treated with appropriate IV antibiotics for at least 10 days, or if they had surgery for that endocarditis, at least 7 days after surgery. And they looked like they were improving, so they had to be stable. They had to be afebrile for at least 2 days. Their CRP was less than 25% of the peak level, or less than 20, and their white count had to be less than 15,000.